Hello aspirants, I welcome you all on the YouTube channel of Analyst IAS. Our today's topic Decodified is the mental health of India or mental health in India. So we will see why in news, what is mental health, what is the status of mental health in India, what are the factors affecting mental health, what are the initiatives by the government of India to tackle the mental health. Then we will look forward towards the way forward. Then we will come to our today's prelims practice question and the mains practice question as well. So we'll start with why news. According to the World Health Organization, India's suicide rate in 2019 was at 12.9 by 1 lakh, was higher than the regional average of 10.2 and the global average of 9.0. Suicide has become the leading cause of death among those aged 15 to 29 in India. While every precious life lost through suicide is one too many, it represents only the tip of the mental health iceberg in the country, particularly among the young adults. Women tend to suffer more in this. What is mental health? So mental health is a state of mental well-being that enables people to cope up with stresses of life, realize their abilities, learn well and work well, and contribute to their community. It is an integral component of health and well-being that underpins our individual and collective abilities to make decisions, build relationships, and shape the world we live in. So, mental health is a basic human right and it is crucial to personal, community, and socio-economic development also. What is the status of mental health in India? So, WHO estimates that about 7.5% of Indians suffer from some mental disorder and predicts that by the end of this year, roughly 20% of India will suffer from mental illness. WHO states that there is a huge shortage of psychiatrists and psychologists in India as well. So there is a huge shortage. The situation has been exacerbated due to the COVID-19 pandemic, making it a serious concern over the world as well, because in the COVID-19 pandemic many people lost their lives and the remaining are still grieving. Now, according to the numbers, 56 million Indians suffer from depression and another 38 million Indians suffer from anxiety disorders. India also accounts for 36.6% of suicides globally. A report published in the Lancet Psychiatry in February 2020 indicates that in 2017 there were 197.3 million people with mental disorders in India. In 2017, the President of India, Ramnath Kovind, asserted that India was facing a possible mental health epidemic. In the same year, 14% of India's population suffered from mental health ailments, including 45.7 million suffering from depressive disorders and 49 from anxiety disorders. These are the statistics on mental illness of India. So WHO says that there are 300 million people with mental health issues all over the world. Estimates suggest that 60 million to 65 million persons have common mental health issues in India. Between 6.5% and 7% of the Indian population have mental health issues. Between 65,000 and 75,000 psychiatrists are needed in India. So there is a shortage of psychiatrists as well. So according to the WHO, stress and depression cases increased by 18% in a decade. And according to various estimates, expenditure on the mental health is 0.06% of the GDP of India. I am telling you these data as that can be important for your mains examination. Now we will see what are the initiatives by the government. So there are some constitutional and legal provisions like Article 21. The article to a dignified life extends to the right to seek mental health care, life and liberty. Article 47, duty of the state to raise the level of nutrition and standard of living and to improve public health as well. The National Mental Health Program in 1982 to ensure the availability and accessibility of minimum health care for all in the foreseeable future, particularly to the most vulnerable and underprivileged sections of the population. Then there is Mental Health Care Act of 2017. It was passed in 2017, came into effect in 18 and replaced the Mental Health Act of 1987 to the joy of the most Indian medical practitioners and advocates of the mental health. This act decriminalized suicide attempts in India. It also included WHO guidelines in the categorization of mental illness. Rights of Persons with Disabilities Act of 2017. The act acknowledges mental illness as a disability and seeks to enhance the rights and entitlements of the disabled and provide an effective mechanism for ensuring their empowerment and inclusion in the society. Now there is Manodarpan initiative. An initiative under Atmanirbhar Bharat Abhiyan aims to provide psychosocial support to students for their mental health and well-being as well. Then there is Kiran Helpline. The helpline is a giant step towards suicide prevention and can help with support and crisis management. The helpline aims to provide early screening, first aid, psychological support, distress management, mental well-being and psychological crisis management, and will be managed by the Department of Empowerment of Persons with Disabilities. What are the factors which affect the mental health? So there are multiple social, psychological, biological, child traumas which determine the level of the mental health of a person at any point of time. Relationships can also be a reason for this. Poor mental health is also associated with rapid social change, stressful work conditions, gender discrimination or social exclusion, unhealthy lifestyle, toxic relationships, physical ill health and human rights violations. What is the way forward? Burden of mental disorders seen by the world is only a tip of the iceberg. To promote mental health, there is a need to create such living conditions and environment that support mental health and allow people to adopt and maintain a healthy lifestyle. A society that respects and protects basic civil, political and cultural rights is needed to be built to promote mental health. There is a need for more promotive programs and campaigns on mental health. The government should press more on allocating more funds in mental health organizations. National mental health policies should not be solely concerned with mental disorders but should also recognize and address the broader issues which promote mental health. This includes education, labor, justice, transport, environment, housing and health sector and many different things as well. Now we will come to our today's prelims practice question. I hope after listening to this whole video you all can answer it. Try to answer it in the comment section. I'll explain you this. Who is a healthy person? First, one who is aware of himself, his feelings and limits. Second, who accepts himself as he is. Third, who does not live in the past or dwell in the future. It means he lives in the present conditions. So you have 4 options. Type the correct answer in the comment section given below. Now we will come to our today's mains practice question, that we can never obtain peace in the outer world until and unless we obtain peace within ourselves. This was all about the today's video. Thank you. Have a nice day. Stay tuned.